家好，各位观众，大家好，欢迎收看港湾 TV。今天是8月17号，我们从镜头里面看到卫生官省新冠Bonnie Henry 以及卫生局局长 Andrew 今天在这个我们温哥华回到了温哥华，不是之前一直在省政府维多利亚的这个地下室，现在是在回到了温哥华。Canada Place， 应该是 Canada Place， 好像这个镜头可看。那么应该是3点钟开始，那么我们已经耐心等候还在调试看得出来还在调试。那么最近呢，说实话，这个从2个礼拜前每天新增，我这边有记录，7月20号还是51个，22号还34个，23号还30个，27号是36个。一直到了8月4号，给大家按3天的这个汇报呢，还是43、29、46。好了，到了8月6号47，到了8月13号就是78了。这个还有87、78， 13号是78。好。
Good afternoon. My name's Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Reka Gustafson, the Deputy Provincial Health Officer, and she has many other titles. But we'll leave it at that for the moment. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Today we're briefing, obviously, here in Vancouver. Tomorrow, Dr. Gustafson and I will release a written statement around 3 o'clock with case counts and other relevant information. And with that, it's my honor, as you know, from the beginning of, or the middle of January on, Dr. Bonnie Henry, our Provincial Health Officer, has been doing these briefings, and she's, of course, done an extraordinary job. But Dr. Henry is part of an extraordinary team, truly extraordinary team of people who have been working really 7 days a week since that time. There are exceptional, brilliant people, not just brilliant people, but compassionate people. And Dr. Gustafson is one of those people, Dr. Gustafson. Really honored, as I always am, to introduce Dr. Bonnie Henry, honored to introduce Dr. Gustafson, who represents literally the hundreds of people in public health who have done so much in recent months to keep us safe. So it's my honor to introduce Dr. Reka Gustafson.
今天是 Dr. Reka Guts 今天是
Thank you very much, Mr. Dix. Good afternoon, everybody. Again, I am Dr. Reka Gustafson. I'm the Deputy Provincial Health Officer and the Vice President for Public Health of the Provincial Health Services Authority, and I'm responsible for the BC Centre for Disease Control. I work side by side with the medical health officers and frontline public health workers, as well as Dr. Bonnie Henry, on British Columbia's COVID-19 response, and I will be providing the public health updates this week. So as always, we start with the case updates, and today we are reporting on 3 periods. From Friday to Saturday, we had 100 cases of COVID-19 in British Columbia. Saturday to Sunday, 88 cases. And Sunday to today, 48 cases, for a total of 236 new cases or diagnoses of COVID-19 in BC, bringing the total for British Columbia since the beginning of the pandemic to 4,594 cases. The distribution of these cases by health authority are 1,419 cases in Vancouver Coastal Health, 2,425 cases in the Fraser Health Authority, 154 cases on Vancouver Island, 405 in the Interior Health Authority, and 117 in Northern Health Authority. 74 cases were from outside of Canada. Currently, in British Columbia, we have 743 active cases of COVID-19, of whom 4 are in hospital today, and 3 are in critical care. 2,286 people in British Columbia are currently under active public health monitoring. We are sad to report 2 new deaths, both in Fraser Health, bringing the total to 198 deaths in British Columbia since the beginning of the pandemic. our sincere condolences to everyone who's
好，我
lost
都
a
会给大
friend
家
or
详细
loved one
解
to
说。
COVID-19. As of today, there are 3,653 people in British Columbia who have fully recovered from COVID-19. We also are reporting some new outbreaks in healthcare facilities. There are 2 new outbreaks in the Chorney Alzheimer's Center in the Fraser Health Region,
听
and
到
the
了啊，
Arbutus
又
Care
有2
Center
个新
in the
的长期
Vancouver
护理
Coastal
院
Health
爆
Region,
发。
bringing the total to 10 active
啊，
outbreaks
现在有
in the
10个
healthcare
长期
system.
护理院
There are
或者
9
急
in
诊
long-term
急
care
性诊疗
facilities
所、
and
急性疾病
assisted
诊疗所
living,
的爆
and
发
1 in acute care.
啊。
In
9 个
total, in
加
British
1个。
Columbia, there have been 690 cases in long-term care facilities, assisted living, and acute care.
我会把这些数字啊，
415
都
of whom
会
were
等他
residents,
们在
and
间隙的时候，我都会
275
给大
were
家
staff. At this
复
time,
述
the outbreak at the Joseph and Rosalie Siegel Family Health Center has been declared over.
啊，有一个被宣布
There
结
are no
束疫
new
情。
community outbreaks to
没有
report
新增
today,
的
but
社
health
区爆发。
authorities do continue to issue community exposure alerts for a number of locations and flights coming in and out of British Columbia. This weekend, Northern Health has issued a community exposure alert for anyone who may have attended the It Is Time Canada event in Deadwood,
这
Alberta
个礼拜谁
from
有
July
去过 It Is
30th
Time
to
Canada
August
的
the
这个
2nd.
活动的，
If you
已经
attended
卫
the
生官员已
event,
经
you're asked to
警告了
self-isolate
这
for
个
14 days
这个安
and
全警告，
monitor
希
for
望大家
symptoms.
如果去
Seek
过的
care
人
should you develop
如果
any
有
of
症
those
状一
symptoms.
定要待在家里，
And
如果没
wherever
有
you
症
live
状
in
自我
British
隔离
Columbia,
14天。
please check regularly the health
所以
authority
请大家经
website
常的
and
去
follow
访问
guidance
我们的
of public health
BCCDC
teams
的网页
should you have
经
been
常
in
看
a
我们
place
那
where
边的
there
有一
is
些新的
a
警告
public
以及
exposure of COVID-19
行动指南，
reported.
包括如何应
So
对
what
等等。
do all these numbers mean for British Columbia today? We do have an increasing number of cases of
他
COVID-19
说
in
我们
British
今天看到
Columbia,
了一定
and the
有新增的
majority of new
新
infections
增阳
in
案例
BC at this time are among young adults. This tells
大
us
绝
that
大
we
多
have
数都
done
是年
today
轻
a
的成
relatively
年人
good job of protecting the
绝
most
大多数的
vulnerable.
我们 BC 省民
But
还是
we
做
are
得很
also
好。
reporting some new outbreaks in long-term care
那么
facilities,
现在看
and
到了
that's
一
a
些
really
新增的
important
长期护理
reminder
院
for
的
us all that the risk
爆
to
发。
vulnerable citizens of British Columbia remains. Now, what does this all mean for us today? What have you learned about COVID-19 since the start of the pandemic? And what is it that we need to do about it? Well, what we do know is that COVID-19, especially among young and healthy individuals, not always, but can be and often is a relatively mild infection. And in fact, the disease can spread with very mild symptoms or before symptoms appear at all. This is again particularly the case for young adults who make up the majority of cases in BC today. This actually makes things quite challenging, and that's because some people may not even realize that they have COVID-19 and they can inadvertently spread it to others, to friends, to colleagues, to family members, and other vulnerable people in their circle, in their community, and even in their workplace. You may look at the numbers of people in hospital and ICU today and feel that things are looking good. And in fact, we should be pleased to see that we are able to, or have been able to, protect those most vulnerable. But it is also important to remember that there are hundreds of people with COVID-19 and hundreds more are self-isolating. And it is very important to remember that for our elders and those with underlying health conditions, the potential for severe disease remains. Again, this may not apply to you, but you could easily spread the virus to someone who is vulnerable through your work or when spending time with friends and family. Today, we have a number of active outbreaks and community clusters, and our public health teams on the ground are very proactively managing and following up these outbreaks, notifying close contacts, and doing all they can to break the chain of infection. But for us to be successful, we actually need everybody to help. With the number of people in BC today, we're at a time when we all need to be particularly alert to how we are feeling. You may feel well enough to see friends and go into work, but rather today, the bar for staying home and staying away from gathering needs to be very, very low. How low? Likely much lower than what you are used to. With any symptom at all, please stay at home. Please do not go into gatherings. And that makes you a COVID-19 champion. A COVID-19 champion who chooses to stay at home and stay away from others when feeling even the slightest bit ill. Making that choice is choosing to keep yourself and others healthy. And in particular, because COVID-19 can be spread before you develop
忽略，
symptoms,
不要
it is
忽略
essential
有可
that
能
if
这
you
个
have
就
been
是新冠疫
contacted
情
by
了
public
不要
health
等
and
到
been
这
told that you
个
are a
症状发展
contact
起
of
来了再来联系
COVID-19,
我们一
please
定要
stay
及
at
时的联系我
home
们
for the
请
full
待在家
period
里
recommended by
请
public
整
health.
个周期
This is
都待在
an
家里
extremely
不要
important way
一
to protect
天两
people
天两天
with
出
whom
去
you work,
这个是我
with
们
whom
卫
you
生官
interact,
给大家
and
的
those in
额
the
外的重
community.
要的一个警告
So where we are
这个是
today
也
is
是
that
对
we
我
all
们
know we
社
need
区来
what
讲
we
也是
all
额
know
外
what we
重
need
要
to
的一
do
个
to
因素
protect ourselves and each other, and this is the time for us to be using
所以
all the
现在对
layers
我
of
们来讲也
protection.
是相互保护、相互
We
支
can
持
all
的
do
时
our
候
part by working
我们大
together
家能
while
够多
staying
一层保
apart.
护
I'm
多
asking
一
you to
层的
please
这
understand the
个
risk
额外
and
的
be an
工作
influencer and a
这样的
champion.
话都
Be
能
the
够阻止
person
病
that
毒的
supports
传
your
播
friends and family to do the right
希
thing
望大家不要
and
成
know
为这
that
个
by
感染
doing so,
源
you're
去感
helping
染
to
人
keep
家
all
感
of
染
us
你的
safe.
朋友感染你
And
的
I'd
家
like
庭
to finish by thanking
所以
all
这
of
个
you
也是希
for
望
what
大家
you're
能够
already
安全
doing
能
because
够
I know that British
时刻
Columbians
考虑周到
are working to protect their friends, their
我们也
family,
大
and
家
their
都知道
community
其
every
实
day.
都很清楚
Thank
如
you.
何保护自己保护家人保护朋友的所以但是这位今天的这个卫生官那个他没有说到Bonnie Henry 的三个
Thank you
著
very
名
much,
的 be calm, be
Dr.
kind,
Gustafson,
be
and,
safe
I wanted to start on behalf of
那么
the
卫生厅
Premier
长
of the
在做
government. I think of all
这个
people
他
in
也说代
BC
表这
to
个
send
政
out our
府
condolences to the
把这
families
个
of the
诚
two
挚的
people
哀
who
悼
died
送
from Saturday
给
to Sunday
过去一天
for COVID-19 in
死
British
于新
Columbia
冠
and
病
to
的
the
家庭
198
现
families
在已
in
经有
total,
198
196
个
other
家庭
families
经历过
who've
这个
lost
痛苦
loved
啊
ones during the
这
pandemic.
个也
It
是
is
这
an
个全球流行
extraordinarily
病所带来
difficult
的痛
time
苦
right now
这个是对
to
大家来
grieve.
讲是
We know
这个
this,
很
we
困
know
难
this, and all of our family units, we know that in this pandemic, which now feels like it's gone on for a long, long time, that we've lost people in our circles that we haven't been able to grieve properly or recognize properly. And so for those people who lost their lives this weekend, including one in long-term care in Fraser Health and the other as well in Fraser Health, we pass on all of our condolences. We are with you in this moment. As Dr. Gustafson, I think, said very eloquently, we really have, it's a bit in British Columbia right now of a tale of two pandemics. People will know from the hospitalization numbers, which were 12 on Friday, I believe, and are now 4 today, that the number of people hospitalized and seriously ill with COVID-19 actually went down over a weekend where we saw a significant number of new cases. The number of people in critical care went from 4 to 3, and sadly, well, 2 people died this weekend overall in the month of August, which is now, is now more than halfway through. The number of people who have passed away is a small fraction of what it is in neighboring jurisdictions such as Alberta and Washington State. So a lot of our effort and a lot of our energy has been to protect the most vulnerable. And you've seen these actions, the actions in terms of long-term care, the extraordinary steps to keep our acute care hospitals safe and operating and functioning and to stop the spread in those circumstances. All of the work of our critical care specialists who've had outcomes in British Columbia that the whole world recognizes as extraordinary. And yet, 236 new cases this weekend, which is the other part of the story that we have to try together to address and to address better. I spent a good part of the weekend, Friday and Saturday and Sunday, engaged with young people, encouraging young people to talk about in their own ways, in their own language, with one another, to influence one another about the issue of COVID-19. I've been actually so inspired by their willingness to do so, by their understanding and their ability to translate some of the things we're trying to say in a way that works for them. And we need that because this pandemic is not ending soon. This pandemic that we're all tired of, so very tired of, will be going on now. We would expect well through 2021 into 2022. The measures we have to take together, this new normal we have to fashion together, and in some ways enjoy together. This new normal is going to be in place for a long time, and the way that we address that, the way we deal with that as a society, is inevitably has to be by choice and by engagement and by talking to each other and by encouraging one another, and when we fall, helping one another up. And that's a big part of what we need to do. As well, we need to, on occasion, have surveillance and enforcement.
所以那么我们也是
And over
经
the
常做一
weekend,
些
as
这
committed,
个民
I
意调
noted,
查
for。example, on Friday, that ongoing surveillance and enforcement operations have
那么也
resulted
是
in the
做了一
closure of
些这
several
个监
bars,
控
restaurants,
啊
and nightclubs
对，特别是
following
礼拜
transmission
五，
events,
我们这个
some
执
by
法机
public
构
health
啊
order and
也
some
是对一
voluntary.
些酒吧和
Just 3 of
餐
those
厅做了
nightclubs
关
alone,
闭，特别
the
是这
Pier
个
Champagne
夜总会
Lounge
他们
and
有
the
爆
linked
发
West
病毒，以
Oak
及
Restaurant,
病毒
along
爆
with the
发的
Ivy
情况，
Lounge
以
and the
及这
Trump
个
Hotel
违
are
反了卫生
associated
条
with
例
significant
啊，
number
这
of
个都
cases
是包
of
括了
COVID-19
他说
as
了一些
public
lounge 啊、
public
Trump
health
Hotel 啊，
continues
还
its
有
case
他
finding
都点
and
名了啊，
management. All
包括
three
了这个
remain closed
我
and
们的
will
公
not
卫系统
reopen
继续的努
until
力在
advised
看
by public
哪
health.
些地方还
This
不对
past
的，还
weekend,
是要关。
as committed,
特别
August
是已经
14th,
给他们
15th, and
建议过
16th,
了，
Fraser
他们
Health
还
and
没有
Vancouver
完
Coastal
全整
Health
改的。
visited a total of 128 banquet facilities. After reported concerns re the number of guests present at some banqueting halls and the concerns re adherence to required
那么他也
plans.
是说到了
We
这个
have,
我们
through
的
that
延
review,
安
and
卫
I'm
生
very
系统的
happy
工作人
to
员
report a relatively
同
no
时在
number
这
of
个8月
places
14、
under
15 号、
concern
16号3
identified
天
6
都
such
进行了
banquet
一
halls
系
which
列
are
的
subject
调
for
查
concern,
特别
which will
是
be,
已
of
经
course,
有
following
6
up
个
to ensure
晚宴厅
that
以
public
及宴
health
会厅
orders
已经
and
没有
guidance
完全
are
遵守我们
followed.
的
We
行为规
obviously
范
take this very seriously,
措
and
施，
following up with
所
the
以被
identified facility, we'll be
命
continuing
令
to
关闭
follow up
他们
with
没
the
有完全
identified
遵守我们
facilities
的
in
行
the
为规
coming
范，
days.
他们
As
没有
well,
完
Works
全严格
APC
的
has
遵照
been
我们的这
performing its
个
own checks
安
over
关
the
部标
weekend
准，
to
所以我们
determine
还会继续
that
的
determine
去
their
跟踪
confidence that
接
employers
下
are
来的
aware
这
of
些
and
在接
implementing
下来的几
the
天里边，包括
requirements
整个周
needed
末
to
我
keep
们都还
workers
会要加强
safe.
执法、加强
And we
检查
also,。of course, have to highlight
那
the
个
fact
也使大家能够
that so many
这个
restaurants and
能
so
够
many
有信心去消费，同
facilities are
时
doing an
也让些
excellent job
业主
in greeting
那
people
个能
following
够
their COVID-19
能够全
plans.
部的
One of the major
严格的
concerns we
遵守我
continue
们
to
的这
have
个
is
行为规
private
范
parties and
采
private
取落实到
gatherings.
位。
And the most dangerous of which, of course, are indoor private parties
他
and
说
indoor
主要是
private
这个
gatherings.
室内是
So
最
we're
安
going
全、
to,
最
we are
危险
continuing
的，
to
所以
review
我们一定是重
what can
点
be
加
done
强
about
对
those
室内
and continuing
餐
to
厅
engage
营
with
业
people
的
and
这个
discourage
检
people
查。
from
我们
hosting
也
such
是希望
gatherings.
能够
50 is
鼓励
not a
大家
maximum.
能够就是
Is not
这
a
个
is not a minimum, I should
不
say,
鼓励大
and
家
a maximum.
举办
50
那么
is
多
the
的室内
maximum
的
number
或
of
者
people
是
who can go
晚宴，
to
或
a
者是人
gathering
群聚集，
in
特
British
别是那
Columbia
些
at this
超过
time.
50个人的。
However,
这个是
depending
50
on
个
where
人是
you
个
are,
顶部
the number
不
that's
不
safe
允
for
许
you
我们
and
的省
who's
就
there
是
is
50
safe for
个
you
不
is
能够再超过
considerably below
50这
this.
个限制。
So in summary, on this
这个
question, I just want to recognize the efforts of
所以
many
再总结一
businesses,
下，我想告诉大
but say
家，
that we cannot
我
let
们
a
在过去的
few
几天
wreck it for
所采
everybody
取的
else.
行动，
And
能够告诉
and
大家
that is
这
the
个
reason
是
why action is being taken. That ministries are meeting and
是
have met today
理
to
所
map
当然的，
out
是
a
大
more
家能够理解
comprehensive
的。
approach to
那个
increase
我们已经
enforcement
关列
that
了一
will
些，他
optimize
说
the。use of enforcement officers beyond public health in
所以
municipalities,
也
health
希望大
authorities,
家
work
能
safe,
够
and police
完全
that
遵
will
守
come
这
into
个我
effect later
们
this week.
卫生
As
条
stated,
例
and based on
我
this
们的卫
information,
生
the
执
government will
法
take
部门
further
加强，
steps
包括市里
to
边的
impose
卫生
stricter
执法部
penalties.
门
You can expect
这
an
个礼拜
announcement from
还
my
会
colleague,
继续的
Solicitor General, later
加
this
强
week
执法，加
on these
强监督。
enforcement measures. Public health, based on
以
these
及包
additional
括如
measures,
果
will continue to exercise
没有
their
落实到位，我们
authority.
就
But
会
we should
采取处
remember
罚。
that
这
public
个都
health
是
is
我们的
fully
公卫
engaged
系
now
统的
in
公布的
supporting
采取
people
措
in
施。
isolation,
希望
in
大家能
contact
够
tracing, and
时
everything
刻
else.
注意遵
Their
守，
role
这个是
in
严格
stopping
的
the spread of
遵守。那么
COVID-19
也是我
is
们呢，也是
paramount,
格外
and
的
we have to
支
ensure
持，
that
给
their
予
role
那
is
些
both supported and
自我隔离
protected
的
in
人，
every
给他们
way
的额外的支
possible.
持。
I
希
also
望
want
他
to
们
briefly,
能够安
sorry
心
to
的
go
在隔
on,
离
I
就隔离。
will briefly give the PPE report
那
on
么今
PPE
天呢，
that we
又
do
是要给
every
大
Monday.
家。
As
每
you
个
know,
礼拜一要给大家一些
from
更
March
新
to last week's report
我
on
们
Tuesday,
省的
August
这
10th,
个防
the following
护措
PPE has
施
arrived
的
in BC.
设备
Just
的
over 6
这个整理
million
情况。
N95 or equivalent respirators, 42 million surgical or procedure masks, 2.4 million pieces of eye protection, including goggles and face shields, 76 million pairs of gloves, just over 5.6 million gowns, which is, needless to say, a lot. Today I can tell you that over the past week, since my update last week on Tuesday, August 10th, up till yesterday, we received the following: 24,403 N95 equivalent respirators, 4,814,300 surgical or procedure masks in the last week, 2,637 pieces of eye protection, 7,747,200 pairs of gloves, and 246,310 gowns. As you will be aware, all of that material is being tested to ensure that it is a safe and efficient product for our healthcare system. Just finally, everywhere, we need to do everywhere and everything we need to do to stop the spread is at our fingertips, more so now than ever, than even 3 months ago. And yet there are those who tap into the fact that we're all tired, that there's a new normal that doesn't hold a candle to what it once was, that we miss what we used to do and what we expected to do. Those hosting and organizing are making their properties available to large parties and gatherings that break the rules, ignore the guidance, and violate provincial health orders should know this. Using a pandemic to pander to those who are ready to bend the rules, not the curve, comes with consequences.
大家看到了 RICK Rick 应该是一个男性名字，偏偏也是一位女性卫生官他是 Bonnie Henry 的同事。那么现在呢，他也始终强调
There certainly isn't from COVID-19. Whether it's those who think they can escape the ravages and lasting impacts of COVID-19, or those who think they can counter our efforts to stop the spread without consequence, there are two things to understand about COVID-19 and our BC effort. There is no immunity, and that to be successful, we have to work together every day and appeal to the best in one another all the time.
Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 14 et 15 août, celle des 15 et 16 août et celle des 16 jusqu'au 17 août, en mi-journée. Il y a eu 2 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 198 personnes décédées COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 3653 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence qui s'étend jusqu'au 15 août, nous avons eu 100 nouveaux cas. Pour la deuxième période de référence qui s'étend jusqu'au 16 août, nous avons eu 88 nouveaux cas. Au cours des dernières 24 heures, 48 nouveaux cas se sont ajoutés. Cela représente 236 nouveaux cas depuis notre dernière mise à jour vendredi, pour un total de 4594 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 4 personnes sont actuellement hospitalisées, dont 3 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And before we take questions, a reminder to the media to please press star 1 to line up for questions. We will be taking one question and one follow-up this afternoon. And again, a reminder to the media, please do not mute your phones. You will not be heard until I call your name. We begin today with Tanya Fletcher, CBC. Tanya, go ahead, please.
Tanya.
Thank you very much. Minister, this first question is for you, and if we could get a response in French on this as well. You just mentioned banquet halls are one thing, but if you can speak to the challenge of monitoring or enforcing behavior at private parties, if those events continue to be a concern, in people's own homes, what more can or will you do beyond education, and will the update that you alluded to from the Solicitor General include penalties around that?
I think it's an important question to deal with. We have as you know, a history of respect for people's homes. A person's home is their castle, they used to say. I think some of that dates back to the Magna Carta, so we want to be respectful of that. And so to be effective across the system, we have to understand and across communities. We all have to understand our obligations to one another. We have seen, and because public health reviews all the cases, that circumstances where people have essentially transmitted COVID-19 to one another in family circumstances with relatively small gatherings. So the importance of physical distancing and the importance of reaching out and convincing people of the need over a very significant time that lays ahead of us, the need to act in different ways is fundamentally important. It's important if you're 21, 31, 56, or 81. It's important for everybody. So that part of it, the convincing part, be asking everybody, but especially what I've been doing this weekend, asking people who can influence people from 20 to 40. By the way, 20 to 40 may be seen as young, and from my point of view, I guess it is seen as young, but it's not young. And people, I think, and the people I've met on this weekend understand that, and understand their obligation to one another and to their parents and to their grandparents, and those that they know who, I don't know, might have diabetes or something, and be even more vulnerable than they are. So the key part of our message, Tanya, is influencing and convincing, as it has been from the beginning, because to be most effective,
这个也是很重要的，对这个病毒，对这些基础病的人冲击特别大。
people in BC have bought in, and we can see that a little bit in these numbers. We have 4 people in hospital today with COVID-19, which is, by our standard, I think it may well be our lowest total since way back in March. Of people in hospitals. So lots of good things are happening. So how do we deal with the issues in home? Those are one of the things we're also looking at in addition to that. And in terms of the responsibilities people have, and that means that those are some of the issues that my colleague and all of a variety of ministries of government are taking a look at to communicate that message and to ensure that's come through. Now, Dr. Henry and the team of public health did make some changes with respect to short-term rentals that were relevant and have been relevant to outbreaks, and will make, I think, a difference in the future. I think those changes came around July 23rd. And she and public health made a series of changes and limits to the number of people who can be invited in short-term rentals, for example, and houseboats and other changes that were, I think, significant changes at that time and that are helpful in enforcing that end of it. But the one place, you're quite right, that's the final challenge that we have to do some convincing, but also look at to see if enforcement could be helpful in this regard, is a private residence party hosted by the person who either rents or owns that residence, and it's a concern, and it's certainly something my colleague, the Solicitor General, is looking at.
Follow-up, Tanya?
En français? OK. Juste en français pour dire que c'est essentiel de convaincre tout le monde, n'est-ce pas? C'est essentiel de convaincre. Et c'est pour cette raison que j'ai passé une grande partie du week-end en parlant avec des jeunes, ou des jeunes, de toute façon des personnes de 20 à 40 ans, de parler à eux et de demander à eux de faire partie de la solution de cette question, de communiquer avec leurs camarades, leurs amis, leurs coéquipiers, qui que ce soit, pour assurer qu'on est en mesure de convaincre et de faire tout ce qu'on veut faire pour se battre contre le Covid-19 qui n'entend pas nos excuses et qui est redoutable. Bien entendu. Donc, on a fait tout cela. En même temps, il y a des choses que le gouvernement est en mesure de faire. Et on va ajouter à nos efforts cette semaine. On a fait un tas d'efforts pendant ce week-end et depuis plusieurs mois. Mais il faut en faire plus. Et mon collègue, le solliciteur général, Mike Farmer, va en parler plus tard.
Thank you. The next question is from David Molko, CTV. David, go ahead, please.
Hi, Minister. I just wanted to follow up on Tanya's question there about enforcement. I know I'm jumping the gun here as well. But on the local level, when it comes to maybe beaches and parks and shopping streets and all of that, what might enforcement look like, and how would you sort of explain that tricky balance between buying in, shaming somebody, and also enforcing it?
沙滩啊，购物场所啊，能不能再找到一些平衡措施确保安全又让那个经济能够恢复？
Dr. Gustafson to speak to this because I think it's really important that there will be no shaming of people who get sick, because we got to help them get better. And overwhelmingly, and I mean even in the last couple of weeks where there's been a significant number of cases, the willingness of people who test positive or who are required to go into isolation because their association with people who've tested positive, that cooperation is essential to stopping the spread. And that involves working with people and supporting them and helping them when they get sick. And that is the essential work that public health does. When we say we have 2,200 people under observation, those people are being worked with every single day by public health, and that part of stopping the spread and of enforcement, that is the most important thing we do, and it's extraordinary work being done by people in public health every day. And so all of those things are important. I think we have to understand and be precise about areas where we have vulnerabilities. And one of those areas, for example, is in the broad area of agriculture and food processing, and we've seen that with a series of relatively large outbreaks in food processing plants, and more recently in a blueberry processing plant in Abbotsford. And that requires a different kind of effort, just as our enormous effort in long-term care, we focused in on those issues, required a different sort of effort. So I think we have to be precise here. The places where there's the greatest danger is our private parties, where alcohol is involved, and it's inside. And I know that people see outside more than inside because it's outside. But those are the places where we have to communicate to people. Don't hold private parties. Watch the Canucks with your bubble in the Stanley Cup run. We've got to communicate that message and find ways, should there be issues, to work with all of the people out there to both encourage people to follow the guidance of public health and to follow the rules of public health, but also, and that's really important, I think, but and provide on the business side of that some clear direction that should rules not be followed, that people are required to adhere to, that they be followed. So these are things we're working with, but maybe I could ask Dr. Gustafson to speak about the
Hi. So yes, with respect to helping people comply with the guidance that we have given, I think one of the things that we need to recognize is that we're all learning together. And we have some broad guidelines that public health has provided based on the characteristics of COVID-19, knowing how it's transmitted, knowing that transmission can occur more easily indoors and when you're in close proximity to people, and especially when you have symptoms or when you have been exposed to COVID-19 and you may be just before your symptoms. So we have given these guidelines over many, many weeks, where I think public health, the work of public health needs to continue and has been very strong, is working with people to apply these guidelines to their context, whether that's a school, a post-secondary institution, a small workplace of 20 people, or a large workplace or a business. The guidelines are actually simple, but when you are applying it to your place of work, your place of study, you will probably have questions. You will need support. And one of the areas where public health has been working very, very hard is providing institutions and services the guidance and the problem-solving day-to-day, as well as healthcare institutions, the day-to-day problem-solving of how do I make that happen and still function and still make sure that I deliver the services that I need to deliver, or that I serve the people that I serve, or I create the product that I need to create. So at this time, we're 6 months into or 9 months into this now, and we're getting close to 9 months into this, and we are still learning together. But absolutely, regulations and enforcement have a role, as Minister Dix has suggested and indicated. There's also a great deal of influencing and learning together and helping each other through being able to follow those rules. And being able to follow those rules varies by your capacity, by your age, and doing the very best we can and learning as we go along. And I would like to speak a little bit about learning. One of the learnings we did was with respect to nightclubs and the types of regulations and recommendations that were put in place for restaurants and how those needed to be changed. And that's a really important learning that we did, and that to which we responded through guidelines and regulations.
Can I have a follow-up, David?
Yeah, Mr. Dix, I appreciate your point there about outdoor gatherings being the most visible, but indoors presenting the greatest danger. And perhaps this follow-up is for Dr. Gustafson.
那么他今天也是说到了，我也赞同你说的这些，尤其是在室内的人权积极这个行为规范。
Linked to parks and beaches and other places, have we seen that at all?
We've had just, I believe, one public exposure that we have put on our website related to an outdoor exposure, but the number of transmissions that have been reported in purely outdoor settings has been very, very limited. The vast amount of transmission is occurring in close, prolonged contact, especially in indoor settings. So that means among people who are spending a lot of time together and in very close proximity.
Thank you. Our next question comes from Denise Ryan, Vancouver Sun. Denise, go ahead, please.
Hi, Minister Dix. And
今天问 Dix 的问题特别多。
is about testing. We're seeing traffic gridlock around testing sites like the St. Vincent site in Vancouver, and people who need tests being turned away from the city center in downtown Vancouver. Why are people being turned away if there's a capacity for 8,000 tests a day in BC?
那么他说了，今天看到很多人都是自觉去测了，但是为什么你们说一天可以8000个测试容量，但很多人被拒绝？
If numbers surge,
是不是你们的资源不够，还是怎么样？
in the fall.
那么到了秋天，是不是你们现在在保守为了秋天的这个流感季节？那么他说，我们现在的容量有2种，一种是实验室的，大家到实验室去。那么这个呢，就是采集了之后，他们去采样，收集了之后去做。
looking at their demand for testing and ensuring that the availability of testing is increased in every region, in every health authority, so that the first step in the test, which means that a person who requires a test, is also available to them as rapidly as possible. We have had a rapid increase in the demand for testing over the last few weeks or last week or so, and we are seeing some delay in the ramp up of that capacity, but I can assure you that all health authorities are working very hard to make sure that capacity is there and that people can receive the test when they need it.
要被要求测试，一种是主动要求。那么现在就是主动要求测试呢，这个现在是还没有完全的放开资源这个容量没有。
Is the delay then in the site testing, when you say there's a capacity for 8,000 to be tested daily in BC, does that mean there's a laboratory capacity but not necessarily a site capacity?
那么因为他是说到有2种啊，我不是很清楚，一种是 site test， 就是当场测的。那么这个也应该是送到实验室去了呀。那么刚才那个女记者问的就是实验室做的测试，也就是说你被要求测试，你必须去测试。一种是自己要求去测试的，这2种就是到 site 就是他说了，今天在这个downtown有2个地方。那么他也是说到了，因为测试的容量增加了，所以测试虽然是大家看到了显著的阳性。
facilities ready to take 5,000 tests if there are 2,000 people coming. We've seen an increase. If you look at the numbers over time, and you can see all this on the BCCDC dashboard, right?
那么他说 BCCDC 的这个网页上应该是看得到每天的数据测试有多少量。
1,500 to 2,000 tests
那么平均呢，我们的社区是1500到2000。我认为他上周4到上周5就这些数字。
And so that number has increased because there's been more concern and more demand in the last number of weeks, and we're able to respond to meet that, and we will.
Thank you. The next question comes from Keith Baldry, Global TV. Keith, go ahead, please.
容量的这个满足他们的需求。
Are those linked to that religious event up in the Peace River area or in Alberta where people came back into Port St. John? And if so, is there a concern that that number may grow in number in the days ahead?
So Northern Health Authority did report those 10 cases, and yes, they were related to that exposure. And that's why the announcement was put forward. And when we do put an announcement out, we are asking people to self-monitor because they have been exposed. And we also are asking them to get a test if they develop symptoms. So the reason that this announcement is put out there is to make sure that people who may have been exposed know that they have been exposed and can get tested. So absolutely, there's a possibility that there will be additional diagnoses related to that. But once we know that there's an exposure, that's actually our goal. That should anybody have been exposed and infected, we diagnose them as early as possible. And the other thing that our goal is with an announcement like this is that if somebody has been exposed, they are currently self-isolating, and therefore in the time period between now and if and when they develop symptoms, they are not exposing anybody else.
就是还有个就是，就算你没有去过爆发的地方就是刚才说的北部卫生局下的，那么你也可以紧密观察自己的症状有的话没有的话如何怎么办
？Confirm this for me. I'm reviewing some of the numbers. Is it true that 100 is the highest number of single-day cases?
那么他说是不是100是当天新增最多的一个数字？
So,
还有今天的 active case 也是最高的
It's the second highest number
是第二高
that we have recorded
100是第二高我们记录下来第二高
to date in the pandemic. And of course the daily numbers are something that we need to monitor. We also need to monitor trends over time and who is getting infected, where those individuals are transmitting to other people, and whether they belong to the vulnerable groups who are at highest risk of severe disease. And as an absolute number, as Minister Dix has just confirmed for me, is the second highest number.
那么他刚才说了100个是第二个高
Follow up, Amy?
And yeah, sorry, just to clarify, second highest single day or second highest case load or active case number?
还有一个 active case.
It's the second highest single day. And one of the things I would also like to just emphasize is that and this is a really important number for us, and we're certainly monitoring it, and public health is very actively responding to the number of infections. One of the other things about this is that we have very broad availability of testing right now, and we are encouraging individuals with mild symptoms to be tested as well. And it does highlight that with that capacity, we are also able to track this epidemic very closely, which is one of our most effective interventions against COVID-19.
更多的跟踪因为大家看到了上个礼拜还是前个礼拜政府扩招了500个公卫系统的这个人专门做这个跟踪调查的工作
I would like you to please explain why police and Vancouver Park Board staff are telling us that they've been directed by the province not to issue tickets to rule breakers on beaches and on the Granville Strip. They claim that it's the province that is keeping them from issuing violation tickets.
那么他说为什么警察告诉他们根据省里边的要求没有给那些违反命令发出告票
jurisdiction's Minister of Health, I'm delighted to look into it, Marcella. I think there was an incident that, as I understand it, and I want everyone to understand that I took Sunday off social media. I didn't take Sunday off, but I took it off social media, that there was an incident on the Granville Strip that caused a lot of disquiet. I also understand that the Vancouver Police Department responded to that in an effective way. So there will be things that come from time to time outdoors that everyone can see, and they are concerns. We have seen people respond. You'll recall there was an incident a few weeks ago around a drum circle, and there was some discussion of it here, and there was a response by reducing the number of people and the amount of physical distancing that took place and dramatically reduced next week. So, we're working and we will be working with all other levels of government and everyone engaging to make sure people are safe. But we need to be precise as well in what we do. And part of the focus that we have right now, as we have in the past, as you recall, there was issues in agriculture, and we made extraordinary steps to ensure that people in public health led this. Vancouver Coastal Health in particular, and Dr. Patricia Daly led this effort to keep temporary foreign workers in quarantine, and that had very positive effects. So we're going to continue to, that's just an example of a precise action taken to reduce transmission. The places we're most concerned about in terms of transmission are parties and close contacts that take place over a period of time, and contacts amongst people in enclosed circumstances. Those are the circumstances that we're most focused on in terms of our enforcement right now. With respect to your specific question, I'll be happy to look into it and get back to you, Marcella.
我看主要是政府的执法的确人员也不够那么还有不单单是这些事情，还有很多的事情，所以他们够忙的。
Jurisdictions, but have you considered implementing single-site orders for schools to ensure teachers and teachers on call are not moving from one building to another in any given district, possibly spreading the virus like we've witnessed earlier this year in healthcare?
Thank you for that question. So public health and the government, of course, are working very, very closely with school boards and individual schools to make sure that there is a safety plan that's implemented in every single school. And the importance, the public health importance and the health importance of getting children back into school cannot be understated. It's really, really important, and we are here to support schools to get children back into education, and we have a lot of reassuring data from around the world that is telling us that it is actually possible to do so. We know that transmission from children to adults is uncommon. We know that adults in schools are not at higher risk of COVID than in the community. We also know that schools are part of the community and therefore reflect COVID-19 transmission. So I'm not going to get to your question. With respect to the single-site orders, the single-site orders were in response to a known demonstrated risk. And with respect to the hierarchy of interventions in schools, the introduction of COVID-19 by potentially infectious individuals, whether adults and children, are most effectively addressed by general safety measures as well as staying at home and when they are sick. I have heard conversations about considering limiting the number of schools that a substitute teacher or temporary teacher attends. At this point, I would say that we don't have a risk indication that would support that, but I can tell you that we will work with our school boards to make sure that any identified risk is addressed through the safety plan.
Thank you, and we have time for one more question. Mr. Dix, would you like to add something? Okay. We have time for one more question this afternoon. For any reporters that didn't get a question today, there will be a statement released shortly for recommendations on protecting families and communities and for access to provincial guidance on COVID-19. Visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And the last question comes from Mike Hager, Globe and Mail.
或者临时老师都来上课了，那么这样的话呢，一个教室里边可能有5个老师、6个老师，那么这样孩子们每个孩子那个孩子们的聚集的人员就会少。那么最后一个问题。那么还是问这个戴口罩上学的问题。
Within the so-called learning groups, the students won't have to wear masks. What are your thoughts on that?
So again, thank you for the question. And again, just to reiterate, I'm just so pleased to see the effort that we're all making together to get kids back into school. It's just so important. With respect to masks, we know that masks in general are quite low on the hierarchy of protections for COVID-19, and that's why they're limited. When we do recommend them, they're limited to the settings but usually during brief periods of time, the other control methods cannot be used. We know that children, again, are not very efficient transmitters of COVID-19, but we also know that you can limit the number, and they are at much lower risk of significant health outcomes from COVID-19 infection. We know that the most most effective way
of
preventing COVID-19 is to make sure that you stay at home. If you are sick, we know that we can add an important additional layer of protection by keeping our groups small, which is what the learning groups are about, and the decision to use masks as an additional layer of protection in situations where the other control measures can't be put in place is something that is being taken right now, and as every other control measure will be evaluated to make sure that children and students are able to do it safely and that it does provide an added benefit. But to your question as to whether I am concerned that children are not going to be wearing masks in other situations, based on all the information that's available to us about COVID in schools, no, I am not.
那么至于你问我的，如果这个让孩子们戴口罩去学校的这个事情，我现在还没有这个确切的消息。但是，那么他说学校会不会增加通风情况？他说我对这个具体的
intervention that's in place right now is certainly something that we can get back to you on. I don't know if Minister Dix has anything further to add.
卫生厅长，你知道吗
？Just I think the Minister of Education did a detailed press conference with some changes today, and I'm sure he'd be happy to respond. I think what you're seeing are two things. One, an extraordinary effort together by people involved to make sure that children and young people, teenagers, are safe when they go back to school, which is essential and important. And the effort, of course, to ensure that people do have the chance and the opportunity, and children do have the opportunity to get back to school. So extraordinary measures are taken, as you're aware. Some $45 million in expenditures is being distributed across BC to make schools safer. And I'm sure the Minister of Education would have more to say on the details of that if you were asking. And with that, thank you very much.
Thank you very much. This is the last question. It's been answered, and that's a wrap. Thank you all for joining us.
那么他说刚才我回答呢是最后一个问题已经回答了那么谢谢大家那么好我们把屏幕关一关。好，我再给大家总结一下是这样，就是今天呢是礼拜一，按照惯例呢还是按照3天给大家做总结第一就是周五到周六新增阳性案例100例这个是比较吓人的那么刚才有记者问这个是不是最高的，他们两个，一个卫生厅厅长，一个 Rick 医生那么说下来说这个是有记录以来第2高单天新增案例，那么这个是100个，那么周六到周日呢是88个，周日到周一48个，总共3天236个，总数到达了4594个。那其中沿岸卫生局1419个，飞沙卫生局还是最多的，因为它的面积最大，2405个。岛上卫生局是154，可能我记错了，还是他们写错了不是，他们说错了。那么北部卫生局是405个，内陆卫生局，北部卫生局是117个，外面带过来的有74个。那么过去的3天新增了2例死亡这个是很不愿意看到的。说实话，这个我觉得就是规律。我刚才说到一半，就是这个长期护理院的问题。长期护理院的问题呢，省政府一开始是做了很大的努力，因为这个我们省呢都是公立的，所以呢全省有570几家长期护理院。那么可能工作的员工有4-5千还是4-5万，我一下子记不住。那么一开始呢是因为这个员工今天在这个养老院，明天在那个养老院，导致呢会交叉感染，所以省政府花了很多的钱，花了很多的努力，使得确保一个员工只在一个护理院工作。那么所有的工作落实完了，已经到6月份了。那么到了6月中旬以后呢，疫情有点下降， 那么现在外面的呼声又大了，说老年人可怜啊，不允许家属去探访啊，很可怜。所以呢，他们呢也就迫于压力呢，到7月份开始要求各个养老院为了开放让老人能够重新被探访，导致呢就是每个养老院落实这个安全措施。那么也是花了1个月左右的时间，全省所有的养老院现在都开放了，至少1周1个养老院指定1个人来看他，不是说我比如说有一个老人啊，他只能指定1个人去看他，条件好的一个老人可以指定2个，1个礼拜2次等等等等。那么所有的都定下来了，突然到了7月底8月初，每周新增阳性案例都是70、80、70、80。但是从言语之间看出来，的确这个年纪轻的多，20到40岁之间啊，主要是社交动物啊。那么从这个答记者问也可以听出很多的信息啊。那么第二呢，从这个数据看，住院人数的确下降。他说上星期五还有12个，今天只有4个了。标准都是一样的，不是说这个标准降低了，你们该回去就回去，本来是住院的，现在赶你们走，这个不存在，我相信 BC 省不存在。那么现在是4个住院，其中3个重症监护。那么好了，所以呢，也就是说这一次的范围，这一次的特征主要是中青年。他也是说到了，就算很多人不觉得有症状，哪怕你自己觉得一点点症状，求求你别出去了，就待在家里14天。还有一点注意，14天要待满14天自我隔离。那么这个呢，就是今天还是比较重要的一个信息。那么同时呢，从不单单是 Bonnie Harry， 今天这个叫 Rick Gibson 好像是叫他也是提到了这个口罩。他说在口罩呢是他们公卫系统这个，当然这个是 BC 省的理论啊，说是这个诸多的卫生措施里边这个层级最低，它叫这个结构性里边，他说是最低的，只有在你不能确保的情况下请戴口罩。因为有一个记者问你们是不是考虑让孩子们强制戴口罩等等等等。那么他也是说到，卫生厅厅长说了整个省额外花了4500万给各个学校去做这些额外的卫生措施那么现在看来还是要保证9月10号孩子们能够安全开学。那么现在呢是这样，就是还有一个数字743，也是第2高的单天的这个 active， 就是每天，但是这个不能说是单天，因为明天也是14，因为这个病周期就是14天，所以一般现在不能说这个 active case 能够有衡量指标。因为有一个女记者问这个今天这个 active case 也是不是最高的，这个其实是没有这个衡量指标。但是新增这个前天就是礼拜6到礼拜天100个，的确是第2高。那么也感谢网友这个 Tim Yu Vic Lee 以及 Melinda Zhu 谢谢你们的留言，也谢谢你们对我的支持。那么明天呢是书面了我们看看后天或者是周4，按照惯例应该是周4。那么欢迎大家时刻关注我们的那个港湾 TV。 好，今天的直播就到这儿。今天天气很热根据天气预报，今天会缓解一点昨天的高压那个今天的高压呢会缓解一点。那么这样缓解一点的话，海风会进来也请大家注意晚上的这个保暖可能后天大后天就要大后天可能要降温，还要下雨我看。好，请大家注意。那个也感谢大家的收看，我们下期再会。